Good evening, Peter Goertz. I'm a psychiatrist. Is it fair for doctors to be paid well, for doctors to make a lot of money? Last night I was on call, and during the week when I'm on call on weekday nights, I generally do not have to go into the hospital. I just get called by the resident who's on call, and the resident tells me about different situations and patients. And I had to wake up a few times last night and talk about patients with the resident. And these decisions that you have to make at night are pretty serious decisions. So deciding whether or not a patient who did something dangerous or potentially dangerous needs to be admitted to a hospital, a psychiatric hospital. So you need some background, history, collateral information if possible, the medical information. So the resident has to go through all that. So it takes a little time. And if you get a few of those calls in the night, that can make you wonder. And that's what happened to me last night. I started the thought crossed my mind, is it fair that doctors, maybe it is fair that doctors make a good amount of money? Because, for example, they have to be on call often. Let's talk about that issue in different ways from different aspects. If you go to an emergency room and you don't have insurance, that can be a very costly endeavor. It can cost a lot of money. So medical care, including doctors' fees, can be very expensive. And one question you may ask yourself after an ER visit or a doctor's visit is, was it worth it? Was the outcome something that was favorable for me, or did I not even need to go? Was it a valuable service that the doctor rendered to me, or was it a waste of money? And one possible approach would be for doctors to only get paid when patients are healthy and doing well. Now, that is one option. Another option would be doctors get paid for seeing many patients, for being quick, and doing many procedures, like, for example, a colonoscopy. And the doctors would get paid then for seeing many patients and doing many procedures, regardless of the outcome. Being a doctor entails having a lot of responsibility. One example is last week, while I was at work, I get an instant message in the computer about one of my patients who said that they wanted to kill a certain person. So that kind of thing can happen. So it can be, you're dealing with situations that can be significantly dangerous, can impact people's lives in a major way. So being a doctor does mean that you have a good amount of responsibility. And another situation, this is from many years ago, I was called at work and I was told that one of my patients just fired a shot at someone. So things can happen, and if it's your patient, you may feel responsible for whatever they do, at least to an extent. Another aspect of the issue, whether or not it's fair for doctors to be paid a lot of money, is the training to be a doctor is extensive, it's expensive, and it takes many years. And in the US, a lot of doctors, once they're finished medical school, end up with a lot of money they need to pay back in the form of loans. Another aspect of being a doctor is often you work long hours, you often work at night, especially during training, so specialty training like internship and residency. And even after residency, often doctors are on call a certain amount. Another aspect is potential exposure to infection, so medically, but also psychologically. At times there can be verbal abuse from patients and even violence from patients. There can be malpractice suits against doctors. So there are many aspects that can be potentially difficult for doctors to address, and one could maybe think, well, because of all these different things, it might be fair for doctors to make a good amount of money. And other people may think, well, doctors, in the visits that I've been to see doctors at, have not really been helpful to me, so why should the doctors make a lot of money? So there are different aspects, different opinions, and we probably don't want to be extreme. So we probably don't want to say doctors are totally worthless, we don't want doctors anymore. We could imagine, for instance, if all the doctors in the US went on strike for a day, what might happen. So that would be a very, very difficult situation. So in my opinion, doctors definitely can be helpful. They're not necessarily always helpful. And simple examples one example from my life is I was at the beach, a big wave came and pushed a lot of sand into my ear, and that was quite annoying. And I went to an ENT doctor who just flushed it all out, and I felt great relief and everything was fine. And obviously in life and death situations, with operations, for instance, doctors can be very helpful, let's say a gunshot wound. So we want to have fair salaries for doctors and for everybody else, and there can be different opinions. So these are some aspects that may be worth thinking about. Thank you.